Hello, I'm Dr. Emma Bolton and I'm going to give you an overview as to the sexually transmitted infection services that we offer at Clinic 66 Online. Now these include but are not limited to sexually transmitted infection, herpes treatment plans and PEP, PrEP and S100 HIV prescribing. So sexually transmitted infections or STIs or STDs are really common, and it's entirely possible to have been exposed or to have an STI and not have any symptoms, and so you may not know about it. Common STIs: chlamydia, gonorrhea, herpes, HPV or human papillomavirus, and less common STIs are HIV, hepatitis B and syphilis. So your risk of getting an STI really depends on your sexual behaviour and whether you have casual encounters or not. So in exactly the same way as we check blood pressure and cholesterol, we actually recommend that you get checked for STIs regularly as well. Now the frequency at which you get tested will depend a little bit on your behaviour profile, and some people get tested every 3 months and some people may not be tested for a year or two. Now if you do have symptoms of an STI such as pain or discharge or a rash, it's actually really important that you get seen face to face by a doctor so that they can examine you and make a diagnosis. But if you don't have symptoms or you think you may have been exposed, then we can look after you online. We can ask you to attend a local laboratory where you can do the test, and then the results will come back directly to us. Herpes is a really common infection, and some people have been exposed to it and they may have never known, and other unlucky people do get regular outbreaks. So if you're a herpes sufferer, somebody who has regular outbreaks, then we can help you with a suppressive treatment plan. We will need to have evidence that you've been diagnosed with herpes, so that will mean getting a swab done or providing us with the result of the swab. But we can help you if you have herpes that needs to have regular treatment. If you have symptoms of herpes or what you think might be herpes, it's really important to see a doctor and actually get a test. But there is a lot of stigma around herpes, and there's a lot of people who suffer mentally as well as physically because of a diagnosis that may or may not be accurate. So a lot of people have herpes and they may not talk about it, but there is a lot of stigma and a lot of myth, and it can really affect you mentally as well as physically. It doesn't mean that you can't have a completely normal life, and our doctors will help you understand this condition and help you manage it, and you'll be able to live with it quite happily. If you are looking for PrEP, PEP or S100 HIV prescribing, Clinic 66 Online can help you. In fact, all our doctors can prescribe PrEP, but if you need PEP or S100 prescribing, then let us know, because we have very special doctors who are able to help you with this, but we will need to make an appointment with them specifically. The good news is that the federal government have recognised that reproductive and sexual health is not done well in primary care in Australia, so they have made Medicare rebates available to you. So if you think that there's something that I haven't covered here, please get in contact with us via the webpage. One of our triage team will be in touch with you, and we look forward to being of service for you because we're here to help.